My name is Siti Norhasanah. Today, we want to talk about types of heart disease. There are many types of heart disease we can talk about today, but right now we will only discuss about 10 types of heart disease. Let's get started with the first type of heart disease, which is congenital heart disease. This is a general term for some deformities of the heart that have been present since birth. For example, septal defects, obstruction defects, and cyanotic heart disease. Moving on to the second heart disease is coronary heart disease. Coronary arteries supply the heart muscles with nutrients and oxygen. So, coronary heart disease usually happens when the coronary arteries become diseased or damaged because of plaque deposits that contain cholesterol. The plaque buildup and narrows the coronary arteries, making the heart receive less nutrients and oxygen. Moving on, myocardial infarction, also known as the heart attack, which is everybody has been worrying about. Interrupted blood flow damages or destroy parts of the heart muscle, and which is caused by the blood clot that develops in one of the coronary arteries. Let's move on to the next heart disease, which is hypertrophic cardiomyopathy. I repeat, hypertrophic cardiomyopathy. It is a genetic disorder in which the wall of the left ventricle thickens, making the blood harder to be pumped. This is the cause of sudden death in athletes. Finally, I will explain mitral valve prolapse. It happens when valve between left atrium and left ventricle does not fully close, which the blood will bulge upwards and back to the atrium.
I continue with the 6 types of heart disease. The 6th is arrhythmia. Arrhythmia occurs when the electrical impulses in our heart that coordinate in the heartbeat do not work properly. Okay. The 7th is dilated cardiomyopathy. Dilated cardiomyopathy occurs when the heart chambers expand because of the weakness of heart muscles and cannot pump blood properly. The common reason is don't have enough oxygen to reach the heart muscle. And the 8th is heart failure. Heart failure occurs when the heart cannot pump blood around the body efficiently. The 9th is mitral regurgitation. Mitral regurgitation occurs when the mitral valve in the heart does not close tightly. This allows the blood to flow back into the heart. The last is pulmonary stenosis. Pulmonary stenosis occurs when the heart becomes hard to pump blood from the right ventricle into the pulmonary artery because the pulmonary valve is too tight.
My name is Nuha. So today I will explain about cause of heart disease. Okay, heart disease is caused by damage to all or a part of the heart, damage to the coronary arteries, or a poor supply of nutrients and oxygen to the heart and to the organ. Okay, for some types of heart disease, such as hypertrophic cardiomyopathy, are genetic. Okay, these, alongside congenital heart defects, can occur before the person is born. Okay. There are a number of lifestyle choices that can increase the risk of heart disease. These include high blood pressure and cholesterol, smoking, overweight and obesity, diabetes, family history, a diet of junk food, age, and a history of preeclampsia during pregnancy. Okay, staying in a stationary position for extended periods of time as sitting at work. Okay, this is also a lifestyle choices that can increase the risk of heart disease. Okay, having any of these risk factors greatly increases the risk of the heart disease. Some, such as age, are unavoidable. For example, once a woman reaches 55 years old, heart disease become more likely.
Shakirah, I will explain how to prevent the heart disease. Some type of heart disease cannot be prevented. Other type can be prevented by taking the following measures. First, eat a balanced diet. Make sure the fats in the diet are mostly unsaturated. Second, exercise system and reduce the cholesterol. Third, maintain your weight for your height. Fourth, if you smoke, quit. Smoking is a major risk factor for heart and cardiovascular condition. Fifth, reduce the intake of alcohol. Do not drink alcohol 14 units per week. Sixth, control conditions that affect heart health as a complement such as
This
diabetes.
is Dania and I will explain about treatment for heart disease. There are two main lines of treatment for heart disease. Initially, a person can attempt to treat the heart condition using medication. If these do not have the desired effect, surgical options are available to help correct the issue. A very wide range of medication is available for the majority of heart conditions. Many are prescribed to prevent blood clots, but some serve other purpose. The main medication in use are: first is statins for lowering cholesterol. Second is aspirin and warfarin for preventing blood clots, and lastly, beta blockers for treating heart failure and high blood pressure. Your doctor will work with you to find a medication that is safe and effective. They will also use medication to treat underlying conditions that can affect the heart, such as diabetes, before they become problematic. Thank you.
Surgeons doing surgery. Okay, heart surgery is an option for people with heart disease, but it can be debilitating. Heart surgery is an intensive option from which it can take a long time to recover. However, they can be effective in treating blockage and heart problems, which medication may not be effective, especially in advanced stage of heart disease. The most common surgeries include angioplasty, in which a balloon catheter is inserted to widen narrow blood vessel that might be restricting blood flow to the heart. Okay, second, coronary artery bypass surgery, which allow blood to reach a blocked part of the heart in people with blocked arteries. Surgery to repair or replace faulty heart valve. Third, pacemaker or electronic machines that regulate a heartbeat for people with arrhythmia. And lastly, heart transplant are another options. But it is often difficult to find a right size of heart and blood type in the required time. Okay, people are put on a waiting list for donor organs and can sometimes wait years. Thank you.
I will read about news about heart disease. Advances are being made every day in the research and treatment of heart disease. A research study to be presented at 2018 Annual Radiological Society of North American Meetings has shown that fat distribution across the body increases the risk of heart disease and other cardiometabolic conditions in women. Smoking just one cigarette each day can increase the risk of heart disease. According to a new study in the BMJ, the research suggests that cutting out cigarettes completely is the only way to reduce this risk, as opposed to simply cutting down the cigarettes.